For millions of Indians, clean drinking water is a luxury. These twice-daily deliveries are a lifeline for Sanjay Camp in Delhi. Children like these and their families, the basics of daily life come before basic healthcare. But India is on the brink of a health revolution. The government wants to offer advanced treatment to 500 million of the poorest people. But it is not using the NHS model. This will not be free for all at the point of use. Instead, 500 million people will get health insurance. They say it's the largest healthcare project ever attempted. Others that it is a folly which will fail the poor. We travelled across India to examine an experiment on a scale to dwarf even the foundation of the NHS. Government hospitals like this one outside Delhi are the closest most Indians get to NHS-style treatment. For hundreds of millions, it is the only option. It costs 1 rupee to register, just over a penny, but after that, treatment is free, up to a point. They see 600 patients a day here and the doctors are besieged. Symptoms, diagnosis and prescriptions are dealt with in minutes. Privacy is less important than pace. In the queue we find people with diseases that have been almost eradicated from the West. This woman has brought her daughter, who has tuberculosis.
Poor hygiene, loss of sanitation, not knowledge about the awareness.
So this is
poverty also.
So this is a disease of poverty?
Yes, of course.
And you have to deal with many
poor hygiene, malnutrition, that's why they got this disease.
If you need an operation, you have to pay. Abdominal surgery costs around £5, and it's more for an extended hospital stay. One surgeon does around 30 a week here. The government insurance scheme would cover the costs.
This will be an excellent idea and it will do great wonders for the poor people if this project is implemented properly.
At the dispensary there's a clamour for basic antibiotics and other medicines available at any chemist. Only here, they're free. They have X-ray, though not always enough porters. The maternity ward is always busy too. But these walls tell their own story. This is the reality of healthcare for most Indians. The Constitution guarantees free treatment, but as the government spends just 1% of GDP on health, that only goes so far. Most pay out of their own pockets. Complex treatment is beyond reach for many. The government insurance scheme is meant to change that, extending operations and cancer treatment to up to 500 million people. It's known as Modicare, after Prime Minister Narendra Modi. For an idea of how it might work, we travelled south to Bangalore, to the largest heart hospital in the world. It's a private hospital, but 50% of treatments are paid for by a state insurance scheme or charity, and subsidised by paying patients. In a country where 4 people die from heart attacks every minute, the core business is surgery. In the paediatric intensive care unit, children recover from life-saving operations. On an adult ward, we met Mrs. China Papa as she waited for an operation to repair a faulty heart valve paid for by a state scheme.
I haven't had to pay any money out of my own pocket.
Tamil Nadu scheme.
An hour later, she was in theatre. Her heart stopped and attached to a bypass machine.
To preserve the patient's own valve, repair it in such a way that the leak stops. They don't need to take the blood thinning tablets. A lot of these patients come from very rural background, so that saves them from doing the blood tests, taking the tablets.
And is it a success, as far as you can see?
Yeah, I'll show you. The valve is very nicely competent.
Less than 2 hours after the operation began, a second surgeon closes the heart.
Right now, the heart is arrested. It is like, there is no beating of the heart. It's like a dead heart. It's not beating. So you can see, heart is like this.
And slowly, miraculously, brings it back to life. Mrs. Chinapapa made a full recovery.
Oh, changed the whole lifestyle. Before she is moving some half a kilometer, she is being breathless. She can't go beyond that. She has to take rest. She can't climb stairs. She cannot go to 2-3 floors. Now she will jump like anything.
There are 5 operating theatres running simultaneously here. This is just one of around 30 operations they'll do here today. The senior surgeon goes from theatre to theatre for the crucial part of each procedure. And this production line technique has allowed them to drive down the cost of heart surgery to around $1,500, bringing it within reach of many more people. The man behind it is Dr. Devi Shetty. He trained in the NHS, was Mother Teresa's personal physician, and runs a private healthcare empire that now includes 25 hospitals.
We believe that India will become the first country in the world to dissociate healthcare from affluence. We will prove to the world that the wealth of the nation has nothing to do with the quality of healthcare its citizens can enjoy. If you collect $50 from individual mobile phone subscriber every month, we can offer surgical care for the entire 1 billion population. Poor people in isolation are very weak, but together they are very strong.
Dr. Shetty is convinced the private sector should deliver treatment and says India has a lesson for the NHS.
Like every system, it has to undergo changes, like different business model of delivering NHS healthcare. Once that happens, it will be a great system and it will last. I'm very, very proud of NHS.
Indian healthcare is rooted in the past, even as it looks to the future. At the Salkia Institute, a medical centre that looks like a spa, royalty and the rich pay more than £600 a night for Ayurvedic therapy. Practiced for more than 5,000 years, it uses compounds of herbs, minerals and oils. It's recognised by the Department of Health, and there are more than 200,000 qualified doctors. Its scientific value may be questionable, but it's been estimated 80% of the population have been treated with Ayurveda. Salkia's founder says this ancient discipline can help tackle modern ills.
India's problem is more than now. When there are pockets of places communicable disease is the problem. But majority of the places more than communicable, diabetes for example, and degenerative diseases, cardiac diseases, these are the major killers. So all this condition, actually lifestyle modification is the most important, along with the diet, along with the treatment in the herbal treatment, and wherever necessary Western medical treatment.
Ayurveda looks more like this for ordinary people. This lady's injured ankle has been treated with lime and honey. But she's had to come to this clinic for a pain-killing injection. We're 3 hours drive east of Bangalore at a rural primary care centre. It serves 15,000 people living in a 30-kilometre radius. Many of them are farmers, like this man who crashed his moped. A single doctor sees around 150 patients every day.
It's very good because they are getting all for free of cost, and they are getting all the care also, health care they are getting. So because a district hospital is very far from here, so it is very good for them to take care from here.
And otherwise they would have to pay and...
Yeah, they have to pay and they have to go to private sector. So that is very difficult for them to go there.
To improve public health, the state employs health workers who go house to house on a mission to educate. Fata is 4 days old and was born by caesarean section, weighing less than 3.5 pounds. Infant mortality in India is coming down, but it's still higher than the global average and worse than in comparable developing nations like China and Brazil.
If there is a pregnant woman, then we give her information about nutrition and the kind of food she should be eating, about the vaccination schedules and the general care she should be taking.
These are the people the governments say they want to help, the rural poor, living in a place where the lack of basic public health measures still causes serious illness. And they're lucky here. They at least have a doctor on their doorstep. What this new government scheme promises to do is provide a financial safety net when their needs go way beyond what can be looked after here. India's emerging middle class presents another challenge. This affluent generation is experiencing a growth in lifestyle conditions like diabetes, which will make the healthcare landscape even more complex. It is a double burden some campaigners believe makes basic public health a greater priority than the government's insurance scheme and private care.
I mean, there's absolutely no evidence that a country like India, which is developing, which has a huge number of poor, communities and poor people, we cannot afford the kind of model that, this Ayushman Bharat or Modicare represents. The private sector has no interest absolutely in primary or preventive kind of healthcare.
These children can already expect to live longer than previous Indian generations, but lifting them out of poverty may do more for their health in the short term than Modicare. It is a plan tailored to the challenge of providing healthcare to more than 1 billion people for a fraction of the cost of the Western model. NHS founder Nye Bevan said the service would be the envy of the world. But given a choice, India has put its faith in social insurance and the private sector. If it succeeds, it may lead the way for the developing world. Paul Kelso, Sky News in India.